counseling chat room, because throughout the year, week on week, we bring on board a seasoned resource counselors, teachers, and experienced men of God to speak to us in our marriages, mostly for free, and we are so grateful to them for that. And then so we are so much privileged to have one of the seasoned SNOs or oncology nurses. She's a specialist who joined us tonight to speak to us on a very important topic, that is Eha Emabibre. And this sickness is so serious that it's stealing the lives of so many women unawares. And until tonight, we have our speaker, Mrs. Gloria Jamna, and we are so privileged. She joined with her husband, Mr. Frank Jamna. Okay, so Mrs., you are the host now. I know you are asking for that. You are the host now. So she's an oncology nurse specialist and a senior nursing officer at the Adidome Government Hospital. And tonight we are so privileged. She is speaking to us on the topic cervical cancer, as a British man would say, and the American man would say cervical cancer is the same. So Mrs. Gloria, you have the audience and you can speak to us now. Thank you.
Okay. Hello, everyone. Good evening. I hope I can be heard.
Sure.
Good evening. We can hear you.
Thank God for today. And it's a talk, but it's going to be a conversation. I'm sure we must have heard a lot about cancers. And this month being January, it's Cervical Cancer Awareness Month. Every January is. I know we are used to October being Pink October, breast cancer awareness and all that. But January happens to be Cervical Cancer Awareness Month as well. And so I'm glad, and it's an honor to be here to interact with this family as well, so that we all can learn about cervical cancer and then the best way forward when it comes to the condition. So by way of outline, we'll look at a little bit of the anatomy of the female reproductive organ. I know we might have done it some time ago in our science class, so we have a fair idea what we are talking about. We'll have a brief overview of cervical cancer. What causes cervical cancer actually? Fortunately for us, we know what causes it. Most cancers, we don't know the cause. You're only limited to risk factors or what increases your chances of getting those cancers. But fortunately for us, when it comes to cervical cancer, we know what causes it. And then what signs and symptoms do you usually exhibit, or are you likely to see when it comes to cervical cancer? And then how is it actually diagnosed? Is it all bleeding? Is it all everything that comes out goes to say that it's cervical cancer? So how do we actually come to that conclusion that this is a cancer and this is not? And so now that we know this is cancer, then how do we treat it? What options are out there for the treatment? And so if we are treating, then we are looking at how do we prevent it? How do we make sure it doesn't even come in the first place? And then what vaccinations are available? Then a few take-home messages, something you can easily remember, and then also, tell people about it. And then we'll have question and answers, and then a reference point. So by the female reproductive organ, this is what we mean. This is the female reproductive organ. And the area of interest, if you can see my cursor, that's where we are concerned about. That is the cervix. So we have the uterus, we have the vagina, we have the fallopian tube, we have the ovaries, we have the cervix. The area of interest today is the cervix. That's where everything starts and ends. So that's where our focus for today is going to be. So this is when you pass a speculum. Well, that's so when we look at you when you're lying down, like a woman in labor lying down, when we look from that angle that you are lying, this is what we see. And this is how the normal cervix looks like. The normal cervix is beautiful, for lack of better words. It doesn't have any abnormality. It's so plain and clear. And then when there are changes, this is how the changes look like. There can be several changes. Not all the changes are cervical cancers. So we'll look at that as well. So when it comes to the cervix, this is the area, although it's a portion, it's not just the round area, it goes a little beyond it. This is where our focus, our concentration would be today. Okay, so I'm sure we've heard so many things about cervical cancer. And so when we say cervical cancer, what actually are we talking about? So like I said, the cervix is the area of concentration. So cervical cancer will usually start at the neck or the entrance of the uterus. And when we say uterus, we are talking about the womb. So it's kind of in the middle between the womb and the vagina. The vagina is low lying, then comes the cervix, then we go to the uterus or the womb. That is what we are looking at. That's the portion we are looking at. And statistics shows that cervical cancer is the fourth most common cancer among women, in fact, in the world. And then when it comes to Ghana, is the second after breast cancer. And I know we because of the breast cancer awareness programs that goes on every year, we know that. But when it comes to cervical cancer, we've not heard a lot about it like we do when it comes to breast. So cervical cancer is the second commonest in Ghana after breast. And the women living with HIV are 6 times more likely to develop cervical cancer compared to women without HIV. And the reason is so simple, because they have a decreased immunity compared to other women, not because other women without HIV cannot get cervical cancer, but they have a higher risk compared to the regular woman who has no other comorbidities or issues when it comes to health. And then most death occurs in low to middle income countries. And Ghana falls under low to middle income countries. So 90% of deaths when it comes to cervical cancer occurs in low to middle income countries. So moving on to what causes cervical cancer. Like I said earlier, we know the cause. Unlike most cancers where we say risk factors, the cause is unknown. Fortunately, we know the cause. And the human papilloma virus, I'm sure we might have heard, or if not, then the human papilloma virus is a viral infection. Causes 95% of cervical cancers. So most of the high grade or high risk cervical cancers are caused by an infection known as the human papilloma virus. And this human papilloma virus is sexually transmitted. So sex of any form. These days with, should I say, is it modernization or something? People are practicing sex of various forms. So any sex of any form increases your chance of HPV infection. And then, it's if in the woman, it progresses to be something else. And most people are infected shortly after the onset of sexual activity. But the good thing is that more than 90% can be cleared eventually and might not progress to cancer with a good immunity. So at one point, you might have contracted this HPV. But the good thing is, because you are healthy, you are living well, and you have a very good immunity, you are likely to wash it out, or your body is likely to clear it eventually, and more than 90% is cleared. But for the ones which are not cleared, they go on to form other things that might later become a problem. And HPV has subtypes, or what we call strands. When it comes to science, we call strands and all that. So HPV also has strands, and the commonest, which is known to be responsible for 50% of cervical cancer, is the 16 and 18 subtype. So there are other strands or other subtypes responsible for other cancers, as well as other health issues. So HPV causes other forms of cancers and health issues. So when we are talking about the cancers, we are talking about the oropharyngeal, which is cancer of the throat, anal cancer, penile cancer, vulvar cancer, and then genital warts. Some HPVs cause genital warts and not necessarily cancers. And if left untreated, if the genital was left untreated and there's reinfection, then it can progress to something else. So even if you are not showing any sign of HPV infection, which you usually would not, you can still infect others with it. So that is what causes cervical cancer. And having been infected with the subtype 16 and 18, which is a high risk or a high grade subtype, is what leads to cervical cancer in the end. And when we talk about risk factors, we are talking about things that put you, increases your chances of getting a condition. So here we are looking at what other risk factors aside the infection. And here you would realize that all these risk factors leads to how you are going to acquire the HPV in the end. So initiation of sexual encounter or intercourse at an early age, so a bit technical here. So due to there's an area in the cervix where the inside of the cervix meets with the outside of the cervix. And that is where we call the transformation zone. And in younger people, it's proven that it's not matured enough. So that is where cervical cancer usually happens, or where it usually starts. So in a younger, or a teenager whose transformation zone is not really developed properly, and then starts sexual intercourse at an early age, is likely not to be able to fight the infection as expected. And then engaging with multiple sexual partners. The danger here is that you might pick the infection from one of them because you don't know who they are also with sexually. So it's a cycle. It will go around and then you might pick one of them. And then you have multiparous or having a lot of children. Having a lot of children with one single problem is that most of the time we have broken homes, and then the woman moves on to marry another man, and then the other man wants children, so you might have 5 children being from different parents or different homes. Like that is the danger. It's not like having your husband and you guys deciding to have 10 children. No, but the risk that all those children might not be from the same person. And then it would mean that you would have moved with a lot of men such that it can expose you. And then decreased immunity. Example is in HIV, like I already said. And smoking. Smoking is linked with a lot of head and neck cancers, and cervical is no different because of the carcinogen in the smoke. So it exposes you. And then sharing of certain items. Certain items like the bentoir we use in the house. All the adults use kind of one bentoir, all the children use kind of one bentoir. So it's if there is an infection, it's easy to go around the house. So what signs will you usually see in a patient who is affected or is showing signs of cervical cancer. And usually you won't see any sign until it's advanced. So at the early stages, what you are likely to see will be abnormal or unexplained vaginal bleeding. And they present in certain forms. So it can be that you are bleeding between your menses. Your menstrual cycle. Every month you bleed once since you started. Irrespective of the number of days you bleed, it's still once a month. But then suddenly you realize that in between menses, there's a bleed. You don't really understand or know where it's coming from. Or at menopause, where you know that, oh, I'm done with all the bleeds and all that. And then suddenly there's a bleed from somewhere. Then we need to be concerned. Or maybe with your partner, with your husband, you have your normal sexual encounter and there's no problem. But suddenly there's post coital bleeding or sex bleeding. And then pain, it comes with pain, with discomfort and all that. So the bleeding is the main thing that you usually see. That will show that it's something is happening. So that is the form in which the bleeding will come. You bleed in between your menses. A postmenopausal woman will start bleeding, postcoital bleeding and all that. Then there's increased vaginal discharge, which can be offensive and sometimes blood-stained. So the normal vaginal discharge is not supposed to be offensive. It's not supposed to be anything. But suddenly it becomes very offensive. And you'd notice that it has become blood-stained at some point, then we have to be worried. And then as the disease progresses, in advanced stage or signs that the disease is progressing, because you would have pallor because of pallor or paleness. I said, is because of the bleeding. And then there's lower abdominal pain. All the time you have lower abdominal pain, you have back pain, persistent leg and back pain, you have vaginal discharge, which is uncomfortable, and then you are losing weight unexplained, not because you're on a diet or doing anything to lose the weight, but the weight is just shedding off. And then you have difficulty in breathing, of course, because you are losing blood because of the bleeding. And then you can also have bladder and the urinary problems. That is when the disease has progressed and maybe has affected the bladder or urinary system as well. So you might show other signs. Depending on where it goes to in the body, you might show similar signs in relation to that. How do we arrive at cervical cancer? Or how do we conclude that this is cervical cancer and not any other or regular bleed from anywhere else? So first thing, we look at the cervix and we call something visual inspection with acetic acid. Acetic acid is a solution, which when we pass a speculum, like I said, you lie like the way the women lie. They lie down when they are in labor and then a device is inserted. So we put, or a solution is, okay, so a solution is made on the cervix, the ectocervix, the outside of the cervix, so that we visualize it to see any changes. So we are looking for any abnormal changes that might occur around that area. And then we do pap smear. It's similar to the VIA, such that with the pap smear, something is inserted to kind of like take a sample of the place. And then the colposcopy is also another form of investigation, such that a device is used. It has a light source at the end, and then we look at it to visualize or look at the cervix. And we have the HPV DNA testing. That one too, we take a sample from the cervix and then go and test if you have the HPV, the human papilloma virus. Then that is how we would also know if you have been infected or not. And then when we talk about cone biopsy, that is taking a sample. So we see abnormal changes and then we are not so sure. So we'll have to actually take a sample kind of like cut a sample of the cervix to take it, further for investigation to see if what we are seeing is what we are suspecting is what it is. So other things we do to see if the disease has progressed is like a CT scan. A CT scan, we'll have maybe a CT scan of the abdomen, go and do a CT, we'll request of the chest or something, just so that we'll see that the disease has not moved from the cervix to some other parts of the body. So it hasn't moved to your lungs, it hasn't moved to the liver or the back or any other part of the body. So this is how we find out, this is how we confirm actually that this is cervical cancer and this is not, aside, all the other changes that are happening and with all the other signs that you are showing. How is it treated? So now we've established that it's cervical cancer. So how do we treat it? And the main thing is surgery. Treatment, okay, so treatment depends on the stage of disease or state of disease. If so we have to be clear in our mind that, okay, this is cervical cancer only limited to the cervix, so we can treat it, or it has spread to the liver, to the bone, to the other parts of the body. So we can't treat, but we can manage symptoms. That we have to be clear right from the onset so that we don't go back and forth, and certain procedures might not actually help depending on the level at which you are. That's why we always stage when it comes to cancers. I'm sure you've heard staging. Staging is important because it will help you to know what treatment direction to go to. So the main treatment option we have is surgery. And when we talk about surgery, it's either we are taking the whole uterus out, the whole womb with the cervix out, or maybe we are taking portions of it, we are leaving some, so that it's depending, so that you can still function, but we might have to take the cancerous part out. So after surgery is chemotherapy. Chemotherapy is a systemic treatment where drugs, cytotoxic drugs or cancer drugs are given through an IV line so that it goes everywhere and then tries to, control or cure the cancer, for lack of better words. And then we have radiotherapy. Radiotherapy is basically introduction of radiation to the site. So if it's the cervix, we can either do external beam where you go and lie in something and then radiation is emitted to the area of the cancer, or the brachy, I beg your pardon, or the brachy where the radiation is introduced to the cervix only. So you lie in one position and then certain things are inserted here and there, and then the emission is done for a few minutes and then you are gone. Or we can have a combined treatment depending on your state or on the stage. So combined treatment, we can give you chemo and then give you the radiotherapy, or we'll do surgery and do radio, like it's a combination. So we can combine any of these treatment options for you. So when we identify that this thing happening is not cancer yet, it hasn't become cancerous yet, it's not cervical cancer, but there are changes. There are changes on the surface, like I showed in the anatomy picture. We need to still get rid of it, because if left untreated, it can progress. Then we are looking at treating with either cryotherapy, and cryotherapy is looking at treating a freezing therapy, let me say that, where the cells are frozen with a very high degree, to a very high degree, such that its blood supply and everything is cut to it, and then what is gotten rid of. Or terminal ablation, where there's burning of these abnormal cells, such that we don't leave it there to progress to the next step, the next stage, which it will probably be cancer. All right. How do we prevent cancer or cervical cancer? And how do we go about it? So in order to achieve complete control, we would have to practice primary prevention. Primary prevention has to do with education, making the people aware, sensitization. We have to be talking and singing about it every now and then. Every opportunity you get, you have to be talking about it. That's the primary prevention. That one, the disease has not even happened yet. Like but we are still talking about it. We are making noise about it and drumming it into the minds and heads of people such that we all come to accept it. Then we are talking about primary prevention. And then vaccination, like the education, we'll keep talking about vaccination, that till the people come to accept it. And then secondary prevention is when the disease, we've seen something, it hasn't gotten to where it's considered bad yet. So we still have to do what we have to do. And that's where screening comes in. So we are looking at it in a population where we'll have to talk about it, and then people will come to screen. When they come to screen and then we see something, then we treat the ones which are yet to be all over the place, for lack of better words. And then we have the tertiary being the treatment for when everything has gone south and such that it's now fully cancer. And so it's either we treat it or we palliate you or we manage symptoms until the inevitable eventually happens. And so this is the, should I say, this three preventive practices are what we are looking at. But with all the risk factors I mentioned earlier, you can also have avoiding of early marriages. Early marriage is an issue. Early marriage is an issue because you are saying that when the younger ones have sex at an early age, it exposes them. So imagine giving out your 13-year-old, giving out your 12-year or your 15-year-old to be married. You are exposing that child to early sexual intercourse. And then what? Eventually, if there's an infection, they are likely to catch it. And then avoid early intercourse. Yes. Then avoiding promiscuity or multiple sexual partners. And then the use of barrier contraceptives. Barrier contraceptives like the condoms, and the female and male are the best because they prevent exchange of body fluids during sex. So it helps in a way to curb the situation. So we are moving on to vaccination. The vaccination and education is what we are focusing on. And when we talk about vaccination, it's given, should I say, an altered form of the disease in a form that your body will try to form its own antibodies against it. So there are two types of vaccines currently being used in Ghana. And that's where we have the Gardasil and then the Cervarix. Those are the two main vaccines being used. And it's recommended for people who are sexually inactive. People who are sexually inactive. So between the ages of 9 to 14 years, the WHO says it's best because we consider that age as still a growing age. They are sexually inactive. So when you are exposing your 14-year-old, you are giving your 14-year-old to an elderly man who probably already has 5 wives to marry, then it means that you are exposing your child. And then if you are sexually active, like in married people like us, sexually active adults should do an HPV DNA test. And if you test negative, then you become eligible because you are saying that the HPV DNA test will show whether you have the infection or not. The vaccine will not cure you. It will not cure the HPV virus if you have it. It will not cure the HPV if you have it. But then if you test negative, then you can go ahead and take the vaccine. So a little take-home message. Cervical cancer is the second most commonest cancer in Ghana after breast, in women, in fact. So let it stay with us. And then let's know that we have to fight for it like we are fighting for breast cancer awareness. And then HPV is the main cause of cervical cancer and is sexually transmitted. Screening and vaccination is a sure way to control cervical cancer. And if cervical cancer is diagnosed early and treated promptly, it can be cured. The HPV vaccine is recommended for both sexes. So for both men and female, the male and female, the HPV vaccine is recommended for both sexes because both sexes go around and then contract from each other and then end up, reinfecting other people. A few questions. Yes, we'll take questions, but there are some pictures I want to show. Viewer discretion is advised. I would want you to see the effect HPV has had on so many people here in Ghana. These pictures are not the ones from the internet we picked from the internet. These are pictures were taken in facilities in Ghana here. And so viewer discretion is, I'm sorry if it's uncomfortable, but this is just something so that we see the extent to which, we would have to make noise about the HPV and then cervical cancer like we do with breast. All right, so that's the end of my presentation. All talk, questions are welcome. Thank you so much for the opportunity.
Thank you very much. Thank you very much, Mrs. We are so grateful for the opportunity to hear from you and on this topic. We've really learned a lot. I have really learned a lot, and I know that the people on board too, everyone has been well educated. Please, it's time for questions. So if you have a question, it's either you unmute your microphone, then I call you, or you raise your hand, then I'll call you. Okay, Uncle, Patrobit me for a bizarre question. Hello, Uncle, Patrobit me can a bizarre question. Okay, sorry. Please, any questions? And if you wouldn't want to ask a question, you can send me a private message, and then your question will be read to our nurse for her to answer.
Prevention.
Hello, Uncle Patrol, Yento Unkenye. Patrol, I would make us.
Hello.
Uncle
Hello.
Patrol to make us a sort of menka. Patrol to menka. Network hygiene. Okay, me Patrol, Obia send it 2 questions. Auntie Patrol, me reading out now one answer my or say a cervical cancer genetic. And the second question or say, can my husband transfer this cancer to me when he has sex with a lady who has been diagnosed of it? And for the meantime, I'm prepared to answer their question, to bring their question. But to me, I answer 2 questions. Where am I?
Okay. So cervical cancer, like I said, and to say cancer, meaning cervical cancer is not genetic. Yeah, establishes a infection be a chance here, or it starts with an infection and yeah, genetics. But when we are taking the history, we ask about a history of cancer in your family, not necessarily because a genetic, but because we would want to know so that when we are looking out for other things, for other cancers which are genetic. Breast, for example, is genetic, but for cervical is established say a infection be a shas here and like it goes to that extent. So cervical is not genetic. And with as to whether say uknu betimidiama is sexually transmitted. And if your husband is infected with HPV, obetimi the amount. The same way, say if you are also infected, so they make it usually goes unnoticed. Even if you are also infected, also betimi the amount because it's sexually transmitted, and I engage in that activity. It's either ways. It's either here or here. It's either say who and I will transmit it, or your husband and I transmit it. That's it about that. That's it.
Thank you very much. Pacho, obi for question now, obi bisa. Obetimi akwenya na ba ho say obetimi ebisa question. Okay, Uncle Pacho, obetimi ebisa question.
It's very answer. You know, I got chance to
Pacho, go ahead.
The man of friend do choose, and then I know it's me, my cancer, no bad. I said, what's all to hello?
Pacho, Uncle. Uncle Pacho,
Yes, unka. Sameti unka ya ubisa se duche no Emma cancer, cervical cancer bana. That's the question, right?
I'm
Uncle Pacho, okasa ye tinti.
Number two.
Obetimi go ahead.
Bia. Yo, Martin, that's it. The tossing me, you know. Hello. The tossing me, you know. Obia. Bia. You me, baby. Na, me, baby, you know. Area also, me, baby. And so, a bit me, and me, bit me, I feel so. Obia. Na the dua no so dua enye easy and so a bit me the aba na because o ka service ho asem na dua no e could do service or no it me e ko fan some bi ba na the question is answer na job one now the last one and it say obia when ni a bad day na sa vaccination na wo kan a bit me aboa ma obe ekwan be so afa e bia vaccinate no so abono ba that's okay 14 years no one but one company for many more money there with us.
Okay, our first question is also duchin etimima cervical cancer bana. Okay, so said the urbano structure no duchin is not supposed to even come in the first place because the vagina, the female reproductive organ is self-cleansing. And one kasasha ne ho eyi nyoma ene eyi nti sa nyoma ni nyina kra entimi mbem but said the mekan no infection no sexually transmitted. Sometimes over tinya peke wo washroom to say ebia obi a cervical obi owo me fan say HPV infection no you see washroom be yeah, we use washrooms all around us. Now also work so and all that, you know. Sometimes, yes, but with douching is not supposed to be, it hasn't been established as a cause, and as one of the risk factors. It will only change the structure down there. It's easy for infections to travel when you have one. So what am I say? So that's the part of the douching. Secondly, say a knee and not being so hairy down there. The hair is not the problem. The problem is the fact that the infection is leaving maybe a man's body into the woman, or the woman's body into the man, because more exchange. That is where it becomes a problem. Hygiene is good to keep the place low and all that. No, one casa will hide your hygiene. Say your perennial hygiene needs, but and yet as in say a nina no and air cause cancer no. So if I go your third question too, you're asking if it has to do with, I think, the manhood, and if it gets to the cervix, it can cause a problem. That is not the point. The point is about the infection. If you have the infection, so we want infection not just say whether a brew or not saying brew, you can transmit it to a partner and now we hear it. To me at the man once I want infection, but say only infection then you don't have to, worry about say a brew and I say a brew. That is the problem. Instead of making the chemical composition, the natural chemical composition. Into a man here is ma abuebia and I say infection a focus. That is where the problem is. Into and then the last one, I say the best for the vaccine, the best is between 9 to 14 years. Fine, but then in the elderly, in 24, you have to do the test. So if you are sexually active, if you are only and other people and no, I was some way test answer. Now we test no now testing negative. I feel ubetini akoso ayeden awo panel. But I don't know if I've answered all your questions. That's it.
Uncle Bacho, oh yeah, okay. Okay, me Pacho, Yaguswa wa question or contribution time. Inti be our question here and go ahead. We have some few minutes
for now.
Pacho, you dance. Pacho, you. Pacho, before our question, I'll be sir. Okay.
Pacho, just a minute. I'm sorry. I have some of my colleagues on board. If they have any additions, if they can add on.
Yes.
To all the conversation.
Yeah. Okay, dear colleagues.
So Mimi, Ivy is here. So Pacho said,
okay.
And then I can also see my sister-in-law here. So yeah. Hello to everyone.
Okay, you can mention their names. Hello. If they have something to add up or not. All right.
Yeah, so Ivy.
Hello.
Are you here?
Yeah, I'm here. Good evening to everyone.
Yes.
Yeah, so that was a very spectacular presentation from our sister. I want to address a little just on the vaccination our uncle asked of. So about the vaccination, young boys and girls between the ages of 9 to 14 years, it is believed that they are not sexually active. As such, they are naive to the HPV vaccine. So once they take the vaccine, they are going to be protected against the HPV. But without those who have already had sexual contacts or has been exposed to the HPV, it is advisable to screen first. And if you are negative to the HPV DNA test, then you can go ahead with the vaccination. Unfortunately for us, we don't have a method of screening for our men as we do for the women, because we are talking about cervical screening. Men don't have sex, women do. But the problem here also is that even though men don't have the service, the same HPV can cause other cancers, as our sister had already mentioned, the oropharyngeal, the penile, and the anal. Men can have those cancers, but we don't have a screening method for men as at now. But other researchers will advise that, okay, you have not screened, but you can still go ahead and take the vaccination. If you are lucky and you have not been exposed to the HPV, that's the DNA, HPV DNA, then you get the protection the vaccine gives. But if on the other side, you have already been exposed to the HPV DNA, then I think that vaccine is not going to work. So basically, that's a little contribution from me with the vaccination. So women who have screened and their test results shows that they are negative to the HPV DNA can go ahead and have the vaccination. So the vaccine, as a woman, my sister had already established that we have the Cervarix and the Gardasil. So with the Cervarix, it gives protection against the high risk HPV. That's the type 16 and 18. So you take the first dose. After a month, you go in for the second dose. And within 6 months, you go for the third dose. But with the Gardasil, we have two types of the Gardasil. We have the Gardasil 4 and the Gardasil 9. So the Gardasil 4 gives protection against the two high risk and two low risk HPV. The high risk, which my sister had already established to be the type 16 and 8, and the low risk, which is the type 6 and 11, which causes genital warts. But with the Gardasil 9, it gives protection against 9 different types or subtypes of the HPV. So basically, that's my little contribution to the HPV vaccination. Thank you very much.
Thank you, dear.
Thank you very much. Auntie Gloria, anyone you want to contribute? Or that's okay.
Amy, are you here?
Please, I have a question.
Please go ahead.
Okay, please go ahead.
Sorry. Please, with some of these vaccines, they will tell you that in an interval of maybe 5 years, you have to have a booster or something. So I would want to know, how long are you going to take the vaccine for? If maybe once or twice, or intermittently, you are supposed to be taking it. Thank you.
Thank you too. Auntie Gloria, please, you can go ahead and answer her.
So with the vaccine, like Ivy just mentioned, you depending on the type you take it either 3 times or twice. So with the Gardasil, you are taking it from three shots. The Gardasil, you are taking 2 shots, and then the Cervarix is 3 shots. So by 6 months, you should take the whole regimen. If it's 3 times, a month after the first one, and then by 6 months you take the second or the third one, and it gives protection for up to it's expected to protect you for a while, for more than 10 years or so. So it's not as if after you taking the vaccine you still stop screening. You can occasionally go in for the screening so that we might still keep track of events that may be happening or certain changes that may be happening. But this one doesn't need a booster like the COVID vaccine does. I don't know if it's answered. If you'd want to. Add on.
Okay, thank you very much for the opportunity. Like my sister said, so with the vaccination, as a woman, once you take vaccine, it doesn't necessarily mean that you have protection for life or you should stop screening. So after the vaccination, every 5 years, you are supposed to go for rescreen. And the vaccine, it is believed that it can give protection for the Cervarix. It is believed to give at least 10 years of protection, whilst the Gardasil can go as far as 11 years upwards. But after vaccination, it is advisable to go for rescreen every 5 years. Thank you very much.
There's a question
Thank
in the
you.
chat box.
Please, any more questions?
SNM.
Okay.
So SNM wants to know, what can we do to prevent today's youth from getting this disease, since they are more prone to it and are active sexually these days? So like we've already established, if we have to catch them young, that is the thing, catch them young. So 9 to 14 years, they're expected to be in the primary schools, going on to the, junior high, and we have to catch them at that stage. If we miss them and then they start being sexually active, then we have no option than to screen. Screening we'll have to test them for the HPV DNA. And once they are positive, then we would have to, when they are negative, then we'll have to, advocate for them to vaccinate. But once they are positive, we only hope that with good immunity and then it's cleared, because research has shown that 90% of the infection will be cleared eventually. But with a good immunity, not all people are fortunate to have that. So I think that would be the best way. We'll have to catch them young at this age, 9 to 14 years. That will be the best time to catch them. All right. I hope it's answered. Thank you.
Hello. Please, can I come in?
Yes, hello, Mimi.
Yes. Good evening.
Yes, please.
Yes. So to add up to what
Evening.
Gloria just said, apart from screening them, waiting for them to be sexually active to be screened, I think it is best to start education from the younger stage. Okay, so even if the person should be sexually active, then definitely using the protection, the barrier methods will be the best, because you don't have to let them wait till they do it unprotected, and then we have to go through the stress of screening them. So it is either we still educate them. So it is more of education, not just HIV and other things. So we usually talk about HIV as sexually transmitted infections, but cervical cancer should also be, I don't even know how to say it. Like, we should always, almost every time,
mention it as much as we do for
cancer.
HIV. Yeah.
Yes, just as we do for HIV. Yes, so that's a little I can add up. Thank you.
Thank you.
Thank you very much. Please, I hope we are all okay. Auntie Gloria, can you give us your last words so that we can wrap up?
Oh, okay. So let's let this images kind of remind us, or let's watch this image as a reminder of the extent to which HPV can go, and then cervical cancer can go. So speak to people about it, just like we've made the Pink October so popular. Let's make January Cervical Cancer Awareness Month also popular, such that people will hear about it. Fortunately, it has a cause, and once the cause, we kind of I don't know, once we kind of are able to take that cost out, we'll be able to save a lot of lives and then save our women. I'm sure the men will be thinking, why are you not talking about us? Yes, because the women are the ones dying. A lot are dying from cervical cancer compared to the men with other, cancers. So thank you for the opportunity, and thank you all who joined in. Thanks to my colleagues, Ivy, Mimi, Esinam, you're here. And then Mami Sawa, you're also here. Thank you so much for joining. Yeah, Joy is also here. All right then. Thank you for the opportunity once again.
Thank you so much for spending time
Thank
to talk to us. And
you.
thank you to all your colleagues for coming to back you up. We are so grateful to you, and we hope that when we call on you again, you avail yourself to educate us on certain things. We are so much grateful unto you. Thank you all. Thank you, Mimi. Thank you, Esinam. Thank you, Joy. Thank you, everyone that's on the page. Thank you so much. Can we please ask Great Osei to pray with us as we close the program? Ms. Osei,
Can we pray?
thank you.
Hello. Yeah. We
Okay.
thank you, Heavenly Father. We bless your holy spirit as faithfulness. We thank you for bringing us to a successful end. We thank you for the education and the understanding. We thank you for this knowledge. We thank you for this life. Father, guide us, protect us from every deadly sickness, and deliver us from the evil one. As we are about sleeping, Father, protect us with the mercy. And let everybody that comes to this platform be a blessing. May we grow from grace to grace, from victory to victory. Commit our sister to your holy hand. Whatever she has lost by speaking to us, Father, restore her knowledge and strength. And let her be a blessing to others too. In the name of Jesus, we pray. Amen.
Amen.
Amen. Thank you all so much. So we'll meet again. Another topic will be put on the main platform, and Auntie Gloria will be put on for the next week, for the week ahead of us. So if you have any question you couldn't ask whilst the discussion was going on, you can ask on the page, and then it will be answered for you. Auntie Gloria, thank you very much, and God bless you and your family. We'll meet again,
Amen.
same
Thank you.
time next week. Good night to everyone.
Good night. Bye-bye. Good night. Bye.